if everyone watching this evening starts advising all their male patients over 50 to insist on a baseline PSA level check, if we then get complaints from GPs, are we allowed to say, well, Professor Bill Ribbans told us to do this?
You can only say that as I'm speaking as a patient, not as a not as a consultant urologist. As I've said, I'm a consultant orthopaedic surgeon.
Yeah.
As Allan has attested to, as I can, if we'd not pushed and been tested, I don't know where the pair of us would be.
Well, you put it this way, I totally agree with what Bill's saying there. I think if the GPs come back and they're upset about it, I said, well, get on with it, because, look what breast cancer, what the women did with breast cancer. They took it to a different level.
Yes.
But,
What I want to do is I want to reassure the osteos and chiros and the physios that if they do this, someone's not going to complain about them and have them go through that horrible complaints procedure with the council, only for the council to say you shouldn't be offering this advice to your patients because it's not national guidance. What does the UK charity is called? Prostate Cancer UK?
Yeah.
Yeah.
And
There are several different prostate cancer charities, but Prostate Cancer UK tends to have the highest profile.
And what is their recommendation?
They are pushing very hard for screening.
Yeah.
At what age?
I think
50.
50s onwards.
Yeah, okay. So that's good leverage then, isn't it? We can say, well, this is the advice from one of the leading charities in the UK. Because
you can phone them, and that's the good. They've got a line. You can phone them, and you can say, listen, I've got these symptoms. I need to be tested, and they'll get it sorted.
Yeah, but that's the issue, isn't it? If you haven't got symptoms, you just want that baseline test.
But I think that's when you go and see a doctor. If you don't tell the doctor you got symptoms, but with Prostate UK, they will.
They're great for the support.
If you want to get tested, they'll organise it.